Hi guys, welcome again to Age Well Healthcare Talk Series by your favorite girl Olainka Aremu, your coach Ola. Today's topic is very important and I need you to please pay attention. So if you want to know which medications your older persons should be careful about, then you should watch this video. You probably know this, but let me just remind you, for those that don't know, that there are some medications that are especially risky for older persons. So in this video, I'm going to be sharing with you those medications that older people should not take or should take with caution. The risky medications, I call them risky medication, that you should pay attention to, especially for your older persons. Number one is what we call the category of benzodiazepines. Or benzos. So benzos are examples like Valium, Artisans, Xanax. So these are kind of tranquilizer or sedatives that, very common that older persons use, especially if they are, they're dealing with anxiety, or they're trying to calm them down. They have some issues. They're just trying to, like, even sedatives. So benzos are those type of medications. In some cases, they have to be prescribed, but they need to be properly monitored, and tapered, not to be used every day. So that will be the first category of medications that are risky. They still prescribe them, but they need to be taken with caution. One category are what is called a non-benzodiazepines. So they don't have, they're still sedative, but they don't really have that much effect like the benzos. But examples would be Zolpidem. So you can check with your doctor, or if your parent or your older person, or you yourself, if you're an older person and you are on Zolpidem, you need to be taken with caution as well. So all these medications, if you check, they are only taken as prescribed. They only prescribed. They are not available over the counter. So they have to be prescribed at the right dose and need to be taken, at the time that it's prescribed for. So they are risky because they affect the brain function. So most of these medications I'll be mentioning, the reason why they are risky is that they affect the brain function, especially benzodiazepines, and even the non-benzodiazepines, they affect the brain function. So we need to be taken with caution. The other category of medications that are risky for older people are what they call anticholinergics, or the popular over-the-counter antihistamines. So like Benadryl is an antihistamine. These medications affect the brain function, kind of slow down the brain and make the patient or the older person at more risk of developing, brain disorders, even Alzheimer's or dementia. Antidepressants are also risky medications. So we know that some older people might, be suffering from depression, so they are placed on antidepressant, but they are very risky as well. And like I said, they also affect the brain function. They slow down the brain function, so you need to be taken with caution. An example of that is Praxil. So most of the time, this medication is avoided as much as possible. Now, the other category I want to talk about is antipsychotics. So this is similar to the antidepressant or what they call the mood stabilizer. So in older adults, they are usually prescribed to manage difficult behaviors like Alzheimer's and dementia. But at the same time, they need to be monitored, they need to be properly, observed, and this medication can only be given on prescription. The fifth category of medications that affect the brain function and are very risky for older people are what we call the opioid pain medication. So for patients or older people that are really in pain, sometimes they are placed on very strong pain medication, but they need to be taken with caution. So example of that is tramadol, morphine, codeine. All these medications are opioid, and they affect the brain function. They kind of affect the cognition of the older people as well. So they are very risky and need to be taken, with caution, and of course with prescription. So another set of risky medications for older people are the non-steroidal anti-inflammatory drugs. Maybe you've heard about NSAIDs. So these medications include over-the-counter painkillers like ibuprofen, naproxen. Do you know that aspirin is also a risky medication? I know a lot of older persons or people use aspirin. But aspirin is a risky medication, needs to be used with caution in older people, especially those age 70 and above. who have not had heart attack or stroke or any cardiovascular event before. So aspirin need to be used with caution because it increases the risk of bleeding in other people. So older people are at risk of fall. So when they fall, they can have brain bleed, and which can cause death almost immediately. So they need to be used with caution and only on prescription, not just over the counter. Again, there are so many medications that are risky for older people. Specifically, you need to check with your doctor or the doctor of your older person to be sure which medication that they're taking. Always cross-check this before they take, and if they have any medication change, that need to also check before they stop any medication or before they start a new one. Make sure that these are cross-checked with their GP or their doctor. Remember, you need to live well for you to age well, and part of living well is also taking your medication appropriately and taking them as prescribed. Thank you so much. In the next video, I'm going to be talking about what you can do about medication safety in aging. So if you are an older person or you have an older person that you're looking after as your parent or relative or carer, what can you do to ensure medication safety for older people? We're going to talk about that in the next video. So stay tuned and let me know what you think. If you have any questions, please drop in the comment section and I'll be glad to answer with the video. Have a lovely day. Bye.